Hi, this is Joshua Collins with Computers Made Effective, and today I want to show you the Dragon Medical Practice Edition 2 speech recognition software. And we're going to be covering the software. We'll do a quick demonstration. We'll talk a little bit about the features and show you just how well it does work in an electronic medical record system. And with Dragon, today I'm using it with a handheld microphone. It's this Nuance Power Mic 2. This is really the easiest and most user-friendly microphone for Dragon. It's our top and most recommended microphone. So it has all the buttons that we're going to help you program and set up to make you more efficient. It has the built-in mouse on it, as well as a speaker. So it's everything you need all in one in this handheld microphone. And again, it's the Nuance Power Mic 2. Alright, so before we get into the demo, I want to quickly cover a couple of the key features with the Dragon Medical Practice Edition 2 software. So this version is more accurate than ever. It's 20% more accurate than any previous versions, and it's 60% more accurate than Dragon Professional. So that's really the benefit of this medical version if you're in the clinical setting. It's going to have the medical specialties built in. It has over 90 specialties in this version. So it's going to have all the medical terms, abbreviations, drug names, anything medical. It's all going to be in there out of the box with Dragon. You'll choose your specialty when you're setting it up. Now it also supports different accents as well. So you're definitely going to get higher out of the box recognition with these accents that come standard with Dragon. Okay? And it also includes some templates as well. So one of the big features of Dragon is not only the dictation and the accuracy of the dictation, but you can also go in there and set up macros or templates as well. So we'll cover that a little bit today and talk about that. But these are really the key features that make Dragon stand out versus any of the other off-the-shelf recognition products or any other versions of Dragon for that matter. If you're in the clinical setting, the medical version is definitely the way to go. All right, so let's go ahead and we're going to quickly get into the demo. Alright, so here we have an example of an electronic health record system, and Dragon is really designed to complement your EMR or EHR system. What it's going to do, it's going to allow you to go in there and dictate and add in your own words in any of those narrative fields, such as the HPI, the assessment, the plan. Anywhere you have an open text box that you can get in there and type into, you'll be able to get in there and dictate in with Dragon. So I'm going to go ahead and go through this example template with you here and just cover a couple of these fields that you would typically dictate. And Dragon's going to do a couple of things. It's going to capitalize the first word of the sentence. It's going to put spaces automatically. You're just going to go through, dictate, add in your punctuation, and you can use voice commands and macros along the way, which we'll talk about. But I'm going to go ahead and start by dictating a few of these sections here, starting with the HPI. The patient is a 37-year-old female admitted through emergency room, period. She presented with symptoms of chest pain, described as a pressure-type dull ache and discomfort in the precordial region, period. Also, shortness of breath is noted, period. Symptoms on and off for the last 3 to 4 days, especially when she is under stress, period. No relation to exertional activity, period. No aggravating or relieving factors, period. Her history is significant as mentioned below, period. Her workup so far has been negative, period. Mother died at the age of 59 due to stomach cancer, and father died at the age of 91 years old, period. Alright, so that was the HPI and family history section. And what we'll do is we'll move on down here through the physical exam. Now, most of the physical exam is going to be pre-populated or generated through the electronic medical record system, but there may be a few areas in there where you want to go in and make some changes or add in your own words. For example, here it says there's a 23-year-old female. Well, that's incorrect. She's actually 87 years old. If you wanted to go back and change anything by voice, you can always do that with Dragon. For example, select 23-year-old female. Now that I have it selected, I could redictate that section with Dragon. 87-year-old female. There we go. And there may be a couple sections down here where I want to add in my own words, such as the cardiac exam here. Now this could be a great example for a macro. anything that you have set up within Dragon, whether it's a few sentences or a paragraph, you could tie that to a 2 or more word command and call that macro up whenever you need it. For example, here I could say cardiac exam, and that will drop in my normal cardiac exam. Cardiac exam. There we go. So that's going to drop in my normal cardiac exam. And I could try the same here for abdomen. Normal abdomen. Alright, perfect. So any section where you may be using kind of the same sentences or phrases between patients, you can go in there and set up a macro and easily call that in by just a few words. So I'm going to go ahead and finish this note up. New line, 1 period. The patient will try Zyrtec instead of Allegra again, period. She states she does not think she has prescription coverage, comma, so that might be cheaper, period. New line, 2, period. Samples of Nasonex, comma, 2 sprays in each nostril given for 3 weeks, period. A prescription was written as well, period. The patient is to follow up with Dr. Carter in 2 weeks, period. Alright, so this was just an example of how you could use Dragon alongside your EMR to go in there, add in your own words in the narrative sections or anywhere that you can type. Alright, so if you guys have any questions or comments, please use the following slide in the video to contact us. And I thank you for your time. Take care.